As we were talking about a few moments ago, Pfizer announced that its testing shows that their vaccine is safe for kids between 5 and 11. The studies tested a 2-shot regimen with kids, and it was less than an adult dose, about a third of it. The response was similar to adults, though they say. They show that it developed a strong immune response. So now it goes to the FDA, and if the FDA does approve it, another 28 million people would be eligible for the vaccine in the United States. Our R9 health expert, Dr. Pyle Coley, joins us now to talk about that announcement this morning. Thanks for coming in.
Good morning, Gary.
So this was not a surprise, I guess. Talk a little bit about what they found out, what more they found out in this study.
Yeah, it was not a surprise at all. And what's interesting about this study in kids is that we're looking at a different outcome. It's called a surrogate outcome. So in adults, when we gave them the vaccine, we looked to see whether it prevented infection and then what degree of infection. Was it mild, moderate, or severe? In kids, we're just looking at the antibody response and using it kind of as a marker for the fact that it likely will prevent infection. Now, when it goes before the FDA, they're certainly going to consider the fact that it's the surrogate outcome, not the real outcome that we're looking at when they make their decision. But in order to shorten the timeline, it was important to do this move.
And everybody knows that because of the situation in schools and that sort of thing, a lot of kids need to get vaccinated as soon as possible. But this emergency use authorization thing, we saw it in adults. People did not trust that as much as they do when they finally give it a final approval. Do you think that'll be the case here too?
Yeah, so this is another interesting question because the FDA has a tough decision ahead of them. Choice number one, emergency use authorize the vaccine based on the surrogate outcome data to get shots into arms and kids and schools safer. Choice number two, do full approval because the risk benefit for kids is a little bit different, right? They don't get quite as sick from the infection as adults do. But we also have to think about kids as, vectors of spreading the infection. They're actually carrying it around and spreading it. So getting them vaccinated is not just about protecting them, it's about protecting the rest of us as well.
Apparently there's a question, because this is for kids 5 to 11. So if a kid is 11 years old, but is a big 11-year-old, do they do the 12-year-old dose or do they do the 11-year-old dose, or how do you figure that out?
We think of vaccines like we think of medications, where it's a weight-based dosing, but that's not really how vaccines work. In fact, even with adults, we feel like the dose might have been too much in the initial vaccine trials, and we might want to think about cutting it down like Moderna is doing for their booster to half dose. So really it doesn't matter. It's not really weight-based. So even if you're a big 11-year-old, you should get the 11-year-old dose because the idea is just to tickle your immune system enough to activate that immune response.
So this leaves, if it gets approved, this leaves the kids under 5 unvaccinated. So what's next for them, do you think?
Yeah, so this is called an age de-escalation. You start with the adults, you go to the teens, and then you go to the younger kids. And so the next set of groups is going to be 2 to 5 and 6 months to 2 years. And they're studying a dose of 3 micrograms, so 1/10 of the adult dose as opposed to 1/3 of the adult dose. And again, they'll have to be real careful in this group because, the risk-benefit really skews in favor of proceeding very cautiously. So we're not going to get that data until the end of the year, early next year, but it's coming on the horizon.
So what's your best guess? What do you think is going to happen next as far as the 5 to 11-year-olds?
I think it'll get emergency use authorized because I think that that's a big chunk of the population, but it's really important that parents are on board with this because a survey that just came out from Kaiser Health Foundation says only 26% of parents would get their kids vaccinated if it was available today in that age group.
Wow.
And that's not going to make a dent if that's really what happens. So.
All right. Dr. Coley, as always, thank you. Appreciate it.